So we know that this bill covers a multitude of sins, or I should say uncovers a multitude of their sins, and just how much they really don't care about the American people. You've got children and dogs and a spouse and a job and all of that. No one has time to weed through all that, and they know that. So that's why we've done it for you, folks.
Yeah.
So buckle up. I remember when they said, no, we're not doing that. No, we just want them to find the waste and the fraud and just, like lean it out, right? But no, we told them absolutely not. We're not touching Medicaid. We're not touching Medicare. We're not touching Social Security. We're just it's gonna be fine, y'all. Well, the CBO estimates that 8.7 million people would lose coverage, 7.6 million more uninsured over the next 10 years, with, we know, rural areas being hit the worst. So it just seems like you said, Lisa, it's the cruelty is the point of it, right? So the CBO in 2022 showed that increased work requirements are less likely to lead to more employment, and more likely to reduce income and benefits, which will lead to higher unemployment. Right. 70% of adults on Medicaid are working in the United States.
And most of the rest of those are disabled.
Yes.
Yeah. So they're either people are already working if they can work,
correct,
or they're disabled, right? If they're not working, it's because they're disabled.
And what about elderly people? Elderly people that may not be living in some kind of a facility or something, but are still trying to manage their life in their elder years, to be able to have the wherewithal to keep up with all of it. And then when you miss one time, and of course everything is done on the internet, and all of you being my friends know that I am the most least savvy internet tech guy in the world. It is the least of my wheelhouses. You all hold my hand daily to walk me through just what we're doing now. But I mean, we have to worry about those people, because it's going to be so easy for those people to slip through the cracks because they don't have an advocate. Who is going to be the advocate for elderly people that are still trying to live and function on their own to keep up with this? Especially since half of the federal government has been fired, and you can't just pick up the phone anymore and find somebody. You can't even pick up the phone and call to check on your Social Security. Who's helping these elderly people? I think that's a huge question that needs to be answered. And I think, they take a broad brush and wipe these things out. Either they completely don't care what the effect is going to have on you, or they're just completely oblivious to the effect that it's going to have on you, in which case both of those scenarios are not good for anyone. Agree?
I don't think they care.
To watch the full podcast episode, which includes a breakdown of the Big Beautiful Bill and its provisions on Medicaid cuts, SNAP cuts, and cuts to the Affordable Care Act, go to YouTube and search at T-Talk Pod, that's TEETALKPOD, or search your favorite podcast platform such as Podbean, Apple Podcasts, or Spotify for T-Talk Podcast.